guys, welcome back to yet another shift, another episode of the biggest, the baddest, the goated medical podcast in Kenya, the biggest shift the trauma podcast. The shift ends, but
the trauma continues.
I am your host, your girl, Fenan Athan Wangare.
And I'm your host, Mo. Karibuni sana. Let's get
traumatized together.
Today, Wangare,
Yes.
how are you?
I'm fine. Niko fiti, niko bio, niko chonjo, niko fantastic. Yourself?
Me, niko better. Yeah, never better.
Better.
Ako
better.
Niko better.
Better.
So today, you suggested, hey.
You suggested I did what?
You said that a very nice topic. Inaitwa the shifts, relatives from hell.
Yeah.
What do you mean by relatives from hell?
I mean,
and who are those relatives? Was relative wangu ni hell? What do you mean?
Okay, first of all, acha niweke disclaimer. Mimi ni Mkikuyu, so mkisikia nimesema relatives, relatives. Munielewe tu na msinijaji. Sawa. So when I meant by how from I can't help it. Aki. I meant like patient amelazwa kwa hosi yako ama kwa ward yako. And then watu wake sawa they are more problematic. They are adding more problems than solutions to the care of the patient.
Now I get.
Yeah. Have you ever come across dramatic or relatives kama hao wenye wana overdo?
Yes, of course. Of course, true. In the last episode, nilikwambia there's just an intentional prayer I make every day when going to the shift. Number one, God, I pray that this day be soft. Number two, I give the best care to my patients. Number three, nisipate incidences. Number four, relatives akiwa zinisumbua. Number five, administration nisipate mashida na administration. Yeah. So, yeah.
Okay. Do you have that one, our patients, our familia moja wenye walikustress the fuck out of you?
Okay. I tend to forget, but of course ni wengi sana. Ni wengi sana. Even my friends wana stress ni wengi sana. Because I have some bullets here. Relatives demanding impossible things, emotional stress they carry, you'll get to them. But let me give you a story. Ama not even a story. What happens sometimes? Unaona mtu like tuseme tu patient ameletewa chakula.
Yes.
Chakula ilikuwa warm. Ikaletwa hapo. Si nurses wanapikanga chakula. Si wao wanaandalianga. But there are people who serve them. So ameletewa chakula. Akaekewa hapo. Patient akasema hapana, acha ningoje kidogo. Nitakula later. Time yenye relatives wamekuja, hiyo ndio time yenye nataka kukula. Ni hiyo chakula hajasema ama hajaagiza chakula kipashwe moto. I know.
Yeah.
Hajaagiza jamani. So ameanza kukula food baridi. And the relatives are like, damn, what the fuck is this hospital? Mbona unakula chakula baridi nini? And at one particular time it shall happen. And I was like, damn, daddy, mbona hukusema upashiwe chakula moto? And I was like, nilikula tu kwa sababu nilishindwa nitaambia nani. Yes, the patient is right. Alisahau ama hakujua who to tell ama how to do it. Okay. And the relatives are like, what happened? How can I help you? No, mlikuwa mnafaa kusema tungepasha chakula badala ya kusema wakati wenye he has already eaten. Ningekutesea mseme, nani anafaa kupasha? Yeah. And thirdly and lastly, haikuisha hapo. Those relatives walienda wakapost in Facebook, this hospital wanapeanga wagonjwa chakula baridi, blah 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 blah. And I was like, okay, yeah, I know you're mad. I know we talked about that, but now there's how the care we give to your dad. Because sometimes they also say people, nurses, doctor, mostly nurses, wako na attitude, but I'm like, really? Umeenda to the depths of it. Wewe mwenyewe umejievaluate venye uliapproach huyo mtu na venye amekurespondia. Kama kuna hata wewe uko na kama kosa kidogo, because you cannot give good things, good vibes, alafu upewe attitude. Umejievaluate. Number two, if you came, you expressed how you feel. What is the need of going to social media and saying that that hospital is bad? No. Yeah, because I don't know, but I feel na feelingi by the way. Okay, I don't know, but yesterday I thought of nikiweza shikwa na polisi maybe tuseme hata misunderstanding nipelekwe SL kama za hapa Nyeri town. Mtu anasemanga I don't want to talk until I have a lawyer. Unaweza fanya hivyo ama ni majuu?
It's your right.
So like tuseme incident tu moja hivyo, wewe umechukua hiyo kitu. Unajua kila time tunasema me as a nurse I'm not supposed to, me as a doctor I'm not supposed to do that because you relatives can see, but what about you? The moment umeenda hapo umesema a certain nurse tuseme tu kidogo, tuseme anaitwa Maureen alifanya hivyo, ako na attitude, aliongelesha patient hivi. Can you sue that person? Because that is defamation of character.
Exactly.
Yeah, professionally acha tu respectiane. You respect me, you give me good vibe, I give you good vibe too.
Sure.
But if tumekaa tu chini ukasema I'm expressing my grievances or whatever, my patient didn't get this, can it be done? Or when can it be done? By who? We are humans. Saa zingine tunasahau wengi. We need to be reminded. We need to apologize for mistakes and everything. But kama tumeongea hivyo, alafu unaenda pale unapost social media I'm calling you out guys. Kindly don't, because utapata na mtu tu ako like me I cannot let that go down. Mi mtu hawezi nifanyia hivyo, I will haunt you. That person will haunt you. Ni ukweli. As much as you want to haunt the healthcare, you want to give lawsuit to that hospital, not even that hospital, that individual. Manze kuna vitu tu unaweza sema huyo msee aseme no. Manze unacheza na license yangu. As long as me I know what I do to God and I played hard. And I also prayed hard. To get that thing. Ai manze wewe hapana.
You know, I have remembered this a post I watched on TikTok something back about someone had gone to the hospital and walikuwa wamelazwa. Then on discharge day, they were not discharged with any medications. So they went to social media then saying hospital so and so tuliwapelekea mgonjwa sasa wamemdischarge bila dawa blah 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 blah. And it really got me wondering, like, first mlitoka hiyo hosi bila dawa, why are you coming to social media? We were literally with them. You didn't tell them. Second of all, some of you mnaendelea kugoogle vitu and then you come to challenge us with what you have read from the internet. What if like hii ugonjwa yake haiko ina need dawa, it just needed to be observed and then maybe akuje clinic with some observations. You see, like some of you relatives, yes, we tuna take care of your patients, but pia wewe like try to understand, like usiruke story, sit down and understand vile kunaendanga so that you can,
or rather I tell them, have some boundaries. Able see what you want to tell us and how to express it, because you can not just come vent what you want to be done, like just do it in a nice way. Hebu fikiria kama ni wewe ungependa kufanyiwa hivyo. Niambie, I know some of you sijui you are business people, you are nini. Hiyo biashara yako nikuje, maybe umechoka nini. Nikuongelesha vibaya simply because I'm a customer and my customer is always right. Niende umesema light.
Nilisema msinijudge kindly.
Customer is always right. Niende hapo niseme shop fulani aliniuzia mchele inaitwa sijui nini, hiyo mchele ni chafu, ni mbaya, ni ya plastic. I'll kill your customer because of one damn bad thing. And it doesn't mean unafanya vitu mbaya all the time. So
then nimekumbuka this relatives. Okay, let's say your patient is in the ward, no? Then sasa ya visiting hours mkuje mtulize swali A, B na C. So mkikuja mtulize, alafu sasa nikisha kujibu natuambia, but my nephew is a doctor. My niece is a nurse. She told me A, B and C. Bro, baby, I hate that. Like, what's your take on that? Akuja kwambie, but grandson yangu mwenye ni daktari alisema A, B na C. Neighbor yangu mama mwingine tunaenda naye kanisa ni daktari aliniambia C. What do you think?
Okay, it depends anawasema in what context.
Okay, let's say like you unajua wewe ndio uko na huyo patient. You are the one who knows the management of this patient. Then wow, they are going to consult like another person who is out there. First of all, let's say this patient hana medical background information ajue certain parameters or certain conditions or certain or hizi vitu fulani zinaendanga hivi. Well, out of the blues you just go and consult whoever you go and consult and then you come and tell us what you want to tell us. Sisi tukijaribu kukuelezea hivi, hutaki kutusikia, unataka kusikiza huyo like basi you take your patient to that person aende amtibu juu mnatuletea stress manzi. As tunaendelea na management yetu, wewe unataka tufanye vile wewe unataka vile umeambiwa like
Yeah, it's true. And some of the doctors from where I come from where I trained were like, there is discharge against medical advice. If you feel you're not giving your patient the good care, you can feel free to take them to other good hospitals.
You can take them.
But if unakuja unasema, I have a concern. Someone told me that this and this could work. What do you think? Man,
or I read somewhere.
I will tell you, I will help you. But yet, no, I don't think this. The last time we were in a certain hospital, okay, so this is also a facility. We have hospital policies, so hata sisi tuko na madaktari ama wetu ni wang'ombe.
Mama wanasema ati hape yangu hiyo hivyo like si ni mimi ndio nampe ati haifai kuenda hivi, inafaa iende hivi bro like the patient is under our care. When you brought the patient to us, of course you trusted us ndio umlete hapo. So like if hata kama uko na inquiries zifanye like something to come to a mutual understanding.
Straightforward. Go direct to the point. What do you want?
Exactly. Yeah. Like sometimes it just feels so overwhelming to deal with some of few relatives. Please, I hope you change it. Manzi.
Our second point, emotional stress they carry and how it spills over staff. Umetoka na huko kwako. Okay, maybe you're stressed over your dad being sick and everything, and you come in like, no. This medication are not working. My dad has been here for a whole week. There's nothing happening. What would you say? My comment on that?
Okay, I don't know what I would say, but I try to explain to them with the context of where the patient is suffering. But yeah, I'll tell you like kindly like sijui to trust ama sijui nikwambia aje, but trust the process.
Okay, I think saa zingine it's good hospital medically to appraise patients and relative more often ili hata wao anxiety ziishe. Unless when you continue giving information and they're not satisfied.
You see, like,
and giving them the truth. If your dad is sick, completely sick, let them know. Let them know what you are doing. Let them know we are trying. Let them know that there's nothing we can do as little compared to maybe a good space, good environment. We're basically doing palliative. Hakuna kitu kingine tunafanya.
I remember like, okay, let's say, for example, someone brings their patient to the hospital. So, and your dad, okay, let's just use your dad. It's
my
dad. Not your dad, but your
dad. Your dad now.
Not your dad. Okay. Your patient amekuja, let's say like wanagonjeka in a condition like maybe like a stroke, ndio. So, si stroke like akona paralysis on one side, that's a disability. You try to, okay, umekuja, stabilize, he's okay, he can be discharged. But now the relatives are like, why is he not working? How is he nini? How is he nini? You appraise them today, tomorrow, the other day. You tell them, now, hatuwezi endelea kukaa na mzee hapa juu the man akaka hospitali, he's even predisposed to infections. Then they're like, hapana, hatuwezi enda naye hatembei, tulimleta huku, ndio atibiwa atembee, lakini hatembei hadi sema ndio akona stroke. You try to explain to them. You explain. You call the counselors to counsel them. You do what you can, you do what you can. Hawataki kusikia. God forbid, or by bad luck, a patient gets like an hospital-related infection and ikuwe severe that inampeleka tu Sayuni. So, inampeleka Sayuni. So, when you come to break the news, they blame it on you. Like, kwa nini? Si tuliwaambia? Si nini? Drama. Okay, si drama, but you pour your hizo emotions kwetu. Na sisi, we had done our best. We had tried to tell you, take him home for rehabilitation. Do this for this. But you guys, you insisted that you want him to be in the hospital. You see, like, to traumatize. You traumatize us as much as pia nyinyi mko traumatized by the death of your loved one. Pia sisi, when you come and pour that career to us, manze, we get traumatized, man. Mnatuongelesha huko vibaya, our day is ruined. You get?
Yeah, I truly get. And another thing, I think they say we treat, but God heals.
Yeah.
So reduce your expectation. So entirely medicine zilikuja man. So yeah.
Plus we just try, like try as much as we can, as much as we can to make your patient feel better. Well,
another one, balancing empathy with boundaries. Empathy with boundaries. What does that mean?
I think it means what, like, being empathetic
rather than being sympathetic.
Yeah.
Okay.
Being empathetic is putting yourself in
their shoes,
right?
Yeah.
So like umesema being empathetic and what
boundaries.
Empathy and boundaries. Okay, like sometimes unaweza kuwa more empathetic, more sympathetic. Nikisema sympathetic nafikiria kulikuwa na kitu kama sympathetic nervous system. Hapana, sympathetic.
Ni parasympathetic. Sympathetic and parasympathetic.
Whatever, man. So like unakuwa so like okay, let me give this example. Like a patient, you have lost a patient in the ward, and now time comes to tell the watu wa huyo patient wenu kwa bahati mbaya ameenda Sayuni. So they start to cry so emotionally, like pia una feel like kama naezalia, yani you feel the sadness, you feel their pain, yani una feel vibaya, unajipata pia wewe unalia instead of observing the boundary of I'm supposed to be strong for these people. I'm the healthcare provider hapa. I'm supposed to be the strong, the bigger person. I'm supposed to comfort them. But unapata empathy yako imevuka boundaries. Ama what are we saying? Umevuka boundaries. You have gone far and wide. And pia about empathy, like like a patient has been hospitalized for a long time, and then muna develop a connection with the patient and the relatives. So like hadi akidischargiwa unapata like you have stepped now from being their healthcare worker to their friend.
I know.
You even goes to a point you marry their own person. You marry their own.
Talk to me directly. No.
Selma, say it. We won't judge you. Ulifanya hivyo?
No.
Yeah. So like that's what I think. What do you think?
But my thoughts are with you. Yeah, I know sometimes it's really hard to be empathetic. We do, but saa zingine boundaries inapitanga. And I had that part when I really connected with the patient, though alikuwa like for 2 months in the hospital, alafu akaenda, alafu akarudi another month, and he was very sick. And I used to attend to that patient more often nikiwa job. So maybe if I didn't attend that patient kila siku someone we used to change ama tukuwa na shortage tulikuwa tuna change na shift hivyo, maybe singe bond na yeye, but ilifika point tukabond hadi na relatives nini. Sometimes it could be a good thing, but kinaweza kuramba man.
Kinaweza kuramba.
Yeah. Wewe
kinaweza kuramba.
Kinaweza because on the other hand you are a professional.
Yeah.
Na sasa umevuka boundary kidogo. Wewe
it can lead to bad.
I know it's hard, but whenever we do that, let's take measures and precautions.
Yeah, let's tukue irada.
Yeah,
It's good to connect and know
protection is
people.
better than cure. Protection is better than cure.
Nimesema hata nimesema vile nimesema, lakini sijasema protection.
Mimi nasema protection is better than cure. To protect prevention.
Sinashangaa protection imetokea wapi na kukiwa? My lord.
Tuna protect nini?
Ede ndio nashangaa.
Okay.
The profession.
Ni ukweli. Because when you protect from getting pregnant, it's better than getting unwanted pregnancy. So inaweza
ati pull up select a rewind.
I mean protection. When you use protection when getting intimacy from young ladies, high school, no, high school ni watoto. Young people not intending to get pregnant,
women of reproductive health, age.
You protect yourself from getting unwanted pregnancy
and STIs
and everything. Umesikia sasa, protection is better than
cure. Speaking of protection, ever you protect yourself, you guys. Let me go to the topic kidogo, because tell me, well, like someone is 86 years old with syphilis, positive syphilis. Mkako kona kaswende. Okay, I'm not saying ako nayo, but I'm saying like let's protect ourselves. Hizi vitu zinaweza kosa kumanifest sahi, but when you grow older unajipata uko na syphilis, unajishangaa pia ulitoa wapi syphilis na uko 90. Na kisonono kama ni kasonono inaitangwa aje?
Kisonono.
Unashangaa uko 90 uko na kisonono kivipi, like, but it is you fumbled when you are young.
Like I would explain for women, ukipata hizo makisonono na nini, saa zingine zina manifestingi tu at that time, but for men zina manifest kwa
mzae muguka.
So let's take care of each other and ourselves. Have you done Wangari?
Yes,
because I want to laugh outside camera.
Okay,
so guys, what do we say? Bye.